This is KC9VKV, and I guess I'm just going to do this at this point. You know, the situation in regards to the coronavirus, well, there are some things that we can do to prepare for the coronavirus outbreak. And this are tips on personal precautions to take if there is an outbreak. Since the coronavirus is new, we have no immunity. Because of that, it can spread quickly. There's no vaccine or drugs to treat it at the moment. So while the United States hasn't experienced an outbreak, on Tuesday, February 25th, 2020, the federal government issued a warning that American families, communities, event organizers, schools, and businesses should plan for that day to come. And here are 7 things the Centers for Disease Control and Prevention says families can do now to prepare for an outbreak should it come, along with precautions everyone should take to avoid the spread of the disease. So let's review those. Let me get my paperwork in order here. Could have done that a little smoother. Anyway, the first thing is planning ahead. Meet with household members, relatives, and friends to discuss what should be done if a pandemic occurs and what the needs of each person will be. Discuss ways to care for those at greater risk for serious complications if the services they rely on aren't available. If your neighborhood has a website or social media page, consider joining it to stay connected to neighbors, information, and resources. Identify organizations in your community that can offer assistance. Consider including organizations that provide mental health or counseling services, food, and other supplies. Create an emergency contact list. Include emergency contacts for family, friends, neighbors, carpool drivers, healthcare providers, teachers, employers, the local public health department, and other community resources. Plan to have extra supplies of important items on hand, such as soap, hand sanitizers, tissues, and disposable face masks, which are already in short supply. Choose a room in your home that can be used to separate sick household members from those who are healthy. If possible, also choose a bathroom for the sick person to use. Plan to clean these rooms daily and prepare for possible school closures. And for personal precautions, stay home when you're sick. If there is an outbreak, stay home if you have been exposed to a family or household member who is sick. Cover your coughs and sneezes with a tissue, throw the tissue away, and wash your hands. Wash your hands, wash your hands, wash your hands. One of the most important things that you can do, wash your hands, often with soap and water for at least 20 seconds. Use at least a 60% alcohol-based hand sanitizer if soap and water are not available. It is especially important to wash your hands before and after touching your eyes, nose, or throat, and to avoid making those contacts with eyes, nose, and throat if at all possible. Clean frequently touched surfaces and objects with soap and water, bleach and water, or an EPA-approved disinfectant. Often touched surfaces include doorknobs, railings, computer keyboards, phones, toys, and desks. And I present that just as a way of, if we do have a problem, you know, something for you to think about, that you might be able to take action to prevent your part, do your part in trying to prevent this coronavirus from becoming worse than what it is. And nobody at this point really knows exactly how bad it's going to be, so we've got to anticipate that it is one mean virus. I know the death rate for this virus is extremely high as opposed to regular pneumonia. So enough of that. This is the KC9VKV, the Qso-Vlog network for Friday afternoon. If you have a radio you want to check out, give me a shout.